Hi, I'm Claire McDonnell Liu, and this is the Family Health Lab. In today's conversation, I'm talking with Dr. Philip Ovadia, a heart surgeon on a mission to help people to get better without meds or surgery. Find out the health myths that he's challenging and the simple steps that you can take to keep you and your family off Dr. Ovadia's operating table.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Hello, hi there, Dr. Philip Ovadia. Thank you so much for joining me. I appreciate your time. It's late in the evening there.
Hi, Claire. Great to be here with you. Always excited when I get to talk to some audience down under. Some great things happening in that part of the world, and happy to connect with you.
Lovely. I'm looking forward to our chat, looking forward to learning more from you. I'm really, really excited by your work and how, you're really prolific as well. You have your own podcast, you have your awesome book, which we'll talk about, and you're also active on social media and you coach. But you managed to squeeze in to all of that. You're a heart surgeon, and you're busy in the operating theatre. So I thought we'd start there. I don't know much about what that looks like for you. So can you? And you've done I've read over 3,000 heart surgeries, which is incredible. So what does a week look like for you as a heart surgeon? How many operations, for example?
Yeah. So, one thing about heart surgery, and I've been doing it for over 20 years now, is it's unpredictably unpredictable. But, on an average day, I'll do 1 or 2 operations. And those operations, typical heart surgery is going to take somewhere between 4 and 6 hours. And, that kind of gives you an idea about how prominent heart disease is in our society, because I am one of only thousands of heart surgeons. So you can multiply that, across the country and then across the world to see what a big problem heart disease is. And, after 20 years of doing this, what I've had my eyes open to over the past, 7, 8 years or so is that most of the surgeries that I do should not need to be done. They're really preventable, and heart disease is largely preventable. And that's more and more what I focus on, is that effort to keep people off of my operating table.
Which is such an important message. I'm just wondering, looking when you're actually looking at the heart and the vessels around the heart, what can you see? Can you, with a 2-decade career looking at heart, have you seen any changes or noticed anything in particular?
Yeah, so, when we talk specifically about atherosclerotic heart disease, the most common form of heart disease that I think most people think of, the plaque that builds up in the blood vessels, usually that's associated with changes on the surface of the heart. And specifically, we see fatty buildup around the heart. Many people might be familiar with the concept of visceral fat, the fat that occurs inside our abdomens around our organs. And it turns out that happens around our heart as well. And, when I compare hearts that I'm operating on for atherosclerosis versus hearts that I might be operating on for other reasons, younger patients with valvular heart disease, problems with their heart valves that maybe they were even born with, the heart is actually a muscle, and it's supposed to be a muscular organ with very little fat on it. But we can certainly see, as people become metabolically unhealthy, the fat builds up on the heart itself.
Goodness, that paints quite a picture. So that's what you're dealing with. That's what you're looking at. That building up around a muscle that shouldn't be there. Yeah, that's quite telling, isn't it, of the state we're getting ourselves into.
Yeah, exactly. And what's sort of a little bit ironic about it is that for the first part of my career, I kind of didn't notice that. It was so ubiquitous, first of all, that I didn't recognize that it wasn't supposed to be there. And, it was just kind of a nuisance because it it makes my job a little harder because I have to find the blood vessels now in this fat. But I didn't really think about why it was there. Now, knowing what I know about metabolic health and, understanding the process better, I come to recognize that that is just another marker of the disease.
That's interesting. And you talk about that a little in your book. You talk about what you see and your reflections on that. Which I think is really interesting in your book. And your book begins with a story of a young lady, a young woman called Corinne. And I was just going to ask you, Philip, why? What was that a turning point for you? The incident with the young woman that you begin your book with.
Yeah, that unfortunate, story that I opened the book was about a young woman with a devastating condition that we couldn't save her, really was a turning point in my career. It sort of brought everything into focus for me. By that time, I had, addressed my own metabolic health problems. I had, lost a lot of weight, like I talk about, and addressed my own issues. But it was really at that moment that it kind of came together for me. What a devastating problem we're dealing with and how we are failing by just taking the approach that, when you get the problem, we'll do the surgery and things are going to be okay. Unfortunately, for that patient and for many others, it doesn't turn out okay. Many patients, don't survive heart surgery. Thankfully, we've gotten a lot better at heart surgery. So today, many more patients survive than used to survive. But even if you survive the surgery, one of the things that I've come to recognize is you're never as good after the surgery as you would have been if you didn't need that surgery in the first place. And, the surgery is a fix. It temporarily improves the problem, but it doesn't address the underlying cause. And if we don't address the underlying cause, the sad reality is that most patients that undergo heart surgery still end up dying of heart disease. They die years later. We add years to their life, improve the quality of their life in many cases, but they still end up dying of that same process. And so that's why we need to address that underlying process.
Absolutely. Root cause. I couldn't agree with you more. And this is what you're all about. This is what your message is about. And the book really is about metabolic health and not just heart health. It encompasses all of chronic diseases that are affecting so many Americans, but also so many others around the world. And really, it begins with your own story. And you say this on your podcast, you say this about your book, that metabolic health has been a big part of your own personal journey and your professional journey. It's across your life. So do you want to share a bit about your own health journey? Life begins at 40, I believe you say.
Yeah. So, going back to childhood, I struggled with obesity my entire life. I was, always overweight and obese, and that problem got, worse as I went through young adulthood. And for the first part of my career as a heart surgeon, I was a very unhealthy heart surgeon. And I reached a point that I was morbidly obese, I was pre-diabetic, and I recognized that I was going to end up on my own operating table, so to speak. I have family history of heart disease. I was traveling down the same pathway that so many of my patients travel down. But like so many of them, I didn't know how to change my direction. I had tried the advice that I had learned to give. Eat less, move more, eat a low-fat diet. We've all heard the advice. And it wasn't working for me, and it wasn't working for my patients. Thankfully, I started to come across different information. My introduction to this whole concept of metabolic health really came from Gary Taubes, again, like so many of us. And I was fortunate to hear him speak at a medical conference. And, the concepts he talked about made a lot of sense. And I read his books and I implemented it. I cut out sugar. I went low carb, and I noticed vast health improvements. And I think importantly, I went beyond that, because then I started asking, why didn't I hear about this in school? Why haven't I learned about this from my colleagues? No offense to Gary in any way, but why did I have to hear about this from a journalist? As a I'm a heart surgeon. You get into that whole thing. And then I came to recognize how insulin resistance is the true root cause of heart disease. And I would much rather do that than, do the surgery that I spend all my days doing. I'm blessed that I have the opportunity to help people that need the surgery, but I would much rather keep you off my operating table.
That's a wonderful message. And I think you also term it as trying to put yourself out of business. You'd rather get back to the root cause, but get back to prevention into the health system. We've touched on the term metabolic health, and I believe that people are confused about that. Is there a way that you can simplify that for us?
Yeah, I do my best to. And you're right. People are confused about this. And quite frankly, most doctors, most practitioners don't understand what metabolic health is. And so the simple way I like to explain metabolic health is when we are metabolically healthy, our body is taking the inputs that we are giving it, and that is primarily the food that we eat, and it's doing the proper things with them. When we eat, one of three things is supposed to happen to that food. Some of it gets turned into energy for immediate use, to all the activities that are going on in our body. Some of it gets broken down so that we can build and rebuild our tissues, another process that's always going on. And then some of it's supposed to go into storage for times when food and energy isn't available. And we have to realize that historically, that was a big challenge. There were plenty of times when food wasn't readily available. Now, our modern food environment has largely fixed that problem, but it's created a new problem in that we put all of this energy into storage and we never give our bodies a chance to use it. We never pull it out of storage. And that has a whole host of negative effects, that break our metabolic health.
And our body is doing what it's supposed to do. It's reacting to all of that energy that we keep putting in, and we put that in at breakfast, and then at lunch, and then at dinner, and then we graze in between, or we snack.
Yeah, exactly. And the negative consequences of that then lead to most of the chronic disease that we see in society today. Things like heart disease, things like diabetes, Alzheimer's disease, many forms of cancer. These have all been associated with metabolic, what we call the metabolic syndrome, which is, just another way of looking at poor metabolic health.
Yeah, absolutely. And for me, it's crazy that we don't have such a strong reckoning in the media, in the public, that so many of us are suffering from these health conditions, and it's down to the food that we eat, but it's more than that. It's down to the food environment that we are tripping over, and it's all around us. It's pushing in on us, and basically that system is geared to put profits and money in people's pockets, but it's making it sick. And the vast majority of us, it's not just a few of us. The numbers are quoted different reports, but 93% of Americans, for example, cardio and metabolic markers are poor. So we've got under 7% of the American population at a healthy level metabolically, which is just shows you how many people need this message, need this support, and we need a society to make a change. Which leads me on to talking about the system. And throughout your book, but also, in your podcast as well, you talk about the rigged system, the hospitals, the doctors, the health professionals, the scripts being rigged against us as individuals. Do you want to share a little bit about that? In fact, you actually come across, Philip, is quite angry about this, which probably motivates you to do all this additional work on top of your load as an already busy heart surgeon. But do you want to tell me your thoughts on this system, the health system that we rely on to keep our loved ones and keep our families well?
Yeah, so the system, we have to recognize, is not interested in keeping people healthy or making people healthy. It is there to take care of sick people. And, the reality is the healthcare system, and this applies worldwide, this is not just the US, has really been overwhelmed with taking care of sick people. There are now so many sick people around that physicians, nurses, all of the practitioners that are involved in the system don't have a chance to step back and say, why are all these people getting so sick? And what can we do to prevent them from getting sick in the first place? And, the unfortunate outside influences that have become very prominent within the healthcare system, things like the pharmaceutical industry, which, I don't blame them for this, but their motivation is to make profits. And having more sick people is a great way to make profits as a pharmaceutical company. Now, it starts to get problematic when we look at things like the pharmaceutical industry is a large sponsor of medical education, medical schools, much of the research that gets done and published, the medical societies worldwide, but especially here in the U.S., are largely supported by the pharmaceutical industry. And, this is where we really start to see the problems occur. And so we have to recognize that your health and my health is not the concern of the healthcare system. Their view of it, I guess you would say, is that we're here to take care of you when you get sick. And unfortunately, they can't do a whole lot to keep you from getting sick. And that's where I put the responsibility back on the individual, back on you and I, to take control of our health and take charge of our health. And we are the ones that are in charge of keeping ourselves healthy.
You talk about that in the book. You call this sovereignty. And it's pretty much, the way you term it is you need to come and save you. You need to come and save your own life, which is pretty stark, that message. But I think it's an important one to realise that, the medication and the surgery is there for you should you need it. But if you want to live a good quality, healthy, active, cognitively well life in your middle years and your later years, then you need to take that action, which is, you do present that quite clearly throughout the book, which I think that's interesting, because I think a lot of us think we can rely on perhaps the food industry, perhaps a government body, to look out for the food environment and the medical environment and pharmaceutical environment, to have that oversight. But actually, you're very much, learn, empower yourself, work with a professional who gets it, and you're in control of this. You've got to be in control of this because nobody else is. In fact, you use a sentence at some point where you say, paraphrasing, something along the lines of, people spend more time choosing their shoes when they're buying their shoes than they do a medical professional. So you think we should shop around?
Yeah, I think as much as you have the opportunity, and I understand that there may be limitations on this, that you should be shopping around for a healthcare practitioner. And you should be asking them questions like, what are you doing to keep me healthy? If I'm on medications, what can I do to get off these medications? Those types of questions can help your practitioner to better help you. Now, the unfortunate reality is that most practitioners are not educated to do that. We spend all of our time in medical school learning about all these different medications and how to put people and when to put people on the medications. We really spend no time talking about how to get them off of medications. And we spend very little time talking about things like nutrition and, how to prevent disease with nutrition or reverse disease with nutrition. So these concepts might not be familiar to your practitioner, your physician, and that's when you may have to take the initiative to go find another physician. Now, the good news these days is that we are a lot more interconnected. We have technology. You and I are literally across the world talking to each other, and I can see patients from just about anywhere, over the internet. I can, through my podcast, through my coaching programs, courses, books, this information can spread a lot easier than used to be the case. So we need to take advantage of that when it comes to our health. And if we're not happy with the state of our health today, go find the answers. Don't accept that, there's no options. While it may be true in rare cases that there truly aren't any options, the vast majority of the time there are options, there are alternatives to taking medicines, and there are things that we can do for ourselves to improve our health.
Absolutely agree with that. And you mentioned nutrition, and that's what you believe is the key piece of this puzzle. And again, in your book, referring back to your brilliant book, which I've read, you actually term food at one point as a poison. So do you believe our food is a poison, and what do people need to know about the food that we're regularly eating?
Yeah, so the vast majority of what's presented to us as food these days is poison. And, it might be a slow poison. You don't die right away when you eat it. But when we keep eating it year after year after year, that's when we see the problems occurring. And so what I want people to think about in their food environment is, what is the real food, the whole real food? What are the things that my ancestors were eating? My grandparents, my great-grandparents, my great-great-grandparents, what were they eating? And what's the stuff that has come along only recently? And that during the time that this other stuff, this processed food, has been in our environment, our health has worsened. So the basic simple message that I like to get out to people is just eat whole, real food.
Is that hard to do these days in America? Last time I was over, I was in Florida, and I was going looking for a place to get some lunch, and looking in the local stores for something to buy as well for later. And fresh food didn't seem in that particular area I was in as easy to kind of come by. So is our food environment stacked against people to do the right thing, to eat more simply, and also how busy people are as well with work?
Yeah, it is. But, there are some very powerful tools and techniques and simple concepts that we can use to integrate it into daily life. And, I have a very busy life. I'm traveling all the time and, in the hospitals, in the operating rooms, and I'm able to make it work. And, it's when you know the simple concepts, when you know what to look out for, that you can find those whole real food, items that may be hidden, sort of out of sight. But, for instance, if you're, going to the fast food restaurant, the typical, burger place, you just order the burger patties and you skip all the other stuff that typically comes with it these days, the bun and the toppings and the soda and the French fries, and, just eat burger patties. Very simple. One of the other really powerful things that comes from eating whole, real food, eating nutrient-dense food, is we get hungry less often. So we have to eat less often. And so, people who are just coming to this, and one of their concerns is usually, what am I going to snack on? I need to prepare my 5 meals and snacks a day. And, part of the answer there is you're not going to need the snacks. You're not going to need 5 meals a day. Most people that do this effectively eat, 2 meals a day, maybe 3 meals a day, and they don't need the snacks in between. So that's something that I, help people to realize, recognize, and understand. But there's lots of tips and tricks that you can get when you reach out, when you get help, and that's where drawing upon the community of people that are doing this, connecting with practitioners, coaches, all of the fabulous people that are out there talking about this now, draw upon that experience and figure out how to make it work in your life.
And that is your message as well. Figure it out. Not that you're alone figuring it out for yourself, but make it individual to yourself. So you're not prescriptive. You do go through in detail in the book, and you talk about different types of eating styles. And you're very flexible about the type of eating styles and how to make this approach work. I mean, for me, in my family, we have some of us on ketogenic diets, quite strict, low carbohydrate diets. My husband's getting quite into carnivore diet at the moment, and we're very interested in that approach. But you're not prescriptive about this works, and everybody should be following this type of protocol. You're interested very much in that flexibility for where you are in your life at that time, but also your cultural experiences and where you live, your age, and all of that flexibility to make this approach work. And for me, at the heart, as a nutritionist, the heart of health, the foundation of health is real food, whichever approach you need to take. And I do have friends and I have clients who've gone low carb, and I've had clients who've gone low carb and they're vegetarians, they're Hindu vegetarians, and we've made that work beautifully, and we've got them off their diabetes medication and off their statins, which was just wonderful over the process of months. So that I think that realistic, real world flexibility is very kind to people. It's very open. But I think people would still be interested in your food, your own approach, and how you eat. So would you talk me through what your day looks like? If it's a good day in the Ovadia household, things are going to plan, what would you be eating throughout the day?
Yeah, sure thing. Happy to talk about that. And as you mentioned, this is about empowering people to have the tools to make it work in their life, because ultimately it doesn't really matter what works in my life, it's what's going to work in your life. And so that's why I tried in the book to go through the options and talk about all of these different strategies and what might be good about it, what might be not so good about some of them, but ultimately what I want people to focus on is it's the result that matters, the result of what you're eating. And if what you're eating is, making you metabolically healthy, keeping you metabolically healthy, then keep doing what you're doing is my message, whatever it might be. But if it's not, that's when we need to pay attention to. And that's what starts to get confusing, because, oftentimes the suggestions that are out there around how to have a healthy diet are not focused on metabolic health. They're focused on other things that have been leading people down the wrong pathway. So for me, as I said, my journey started with low carb, eliminating sugar, and then eliminating processed food as I started to recognize that there were things beyond the carbohydrates and the sugars that were harmful in our food environment. And ultimately, I settled on a carnivore diet, and I've now maintained a, mostly carnivore diet for the past 4 years or so. And a typical day for me, I'm going to eat once, maybe twice. I'm probably going to eat about 2 pounds of meat of some sort. And, that's a mix of steaks, ground beef. I try and get in some other ruminant animals, things like bison that are available here. I do eat a fair amount of seafood. I'm fortunate to, where I live, that's readily available and I can get good fresh seafood. And eggs, I'll mix in some eggs. And, that about covers it. I might have some dairy here and there. I don't do a whole lot of it, but, some yogurt, some cheese, I tolerate it fine. Some people don't, and they need to eliminate that, but that's where you start to get into the individuality. And, that works for me on many levels. It helps me to maintain my metabolic health first and foremost. It's simple. It's easy. I don't have to do a lot of planning. I don't have to think about, what I'm eating. I'm not counting, this or that. So that's why I really stuck with the carnivore diet. It's what has allowed me to feel my best, and it's easiest for me to maintain, with my lifestyle.
And a lot of people like the simplicity. We actually, strangely, as a family, found a ketogenic diet quite simple because the parameters were so clear. And, the output, we wanted to be in ketosis for particular reasons. So, yeah, we enjoyed that. And then, having the flexibility of carbohydrate diet as well. But, I hear a lot of people talking about the simplicity. So my husband, I thought it was quite amusing. You talk about bison because I've never contemplated in my life eating bison. I'd never come up, although I have tried moose in Norway. But my husband, on his at the moment, he's on going through a carnivore period, and he's having eggs with kangaroo meat. so yeah, just the where you are in the planet, what you have access to in terms of maybe affordable meat, protein or food. But also, what's potentially sustainable and quite a healthy option. You've got, you live with your daughters. You've got, and you've made these changes from your 40s when you had young children. So how does it work in a family setting, making these types of adjustments as a family? Does that throw up more challenges for you all?
I really don't think it does. My wife, my children, they're not, I would put them more in the low carb category. So, I'll make my steak or whatever it is, and they'll make some vegetables and maybe a baked potato or something to go with it. My children are fortunate that they've been introduced to these concepts early on, and they've already, gone down a different pathway than I did. I was already obese by the time I was their age. They've been able to avoid that thus far. But they certainly understand this. And, they live life, and they go to friends' houses and they might have some of the other stuff and they go to the birthday parties. But they start to recognize, and I can already see this, that they say, yeah, I don't feel as good when I eat this. And so they're starting to make these choices for themselves. And I think that's what's important when you're dealing with children is, if you force them and you tell them you can't have this, the natural instinct is they're going to want it more. If you educate them about these things, and I talk to them, we're very open, they see the pictures of me from back in those days. And, they recognize the improvements, and that helps to connect it to them even more so because they see how my health has changed, and that can be a good model for them. So, you can definitely make this work in a family environment. I certainly know some families that, they're just a carnivore household. And, everyone, eats it. And that's a great approach, I think. For us, like I said, it's, they've kind of settled on their own. If we go out to eat, for instance, and we ask them, where do you want to go to eat? It's usually going to be a steak restaurant. if we go out and order burgers without us having to tell them, they order the burger without the bun. So they're, like I said, they're starting to pick up on this. They're starting to learn this for themselves, and that will set them up, for lifelong success. What I have intentionally not done with my children is say, okay, you have to do this, be super strict with them, because then when they leave the house, when they grow up, when they go to college and all of that, the natural tendency then is to go get all that stuff that they weren't allowed to have at home.
Absolutely. And it comes back to your point that you're trying to get across for your patients and your clients, and and your message is it's sovereignty, and that starts from a young age, having the access to the good options and having the awareness and the education. But then if they're metabolically well, being able to try other foods and see how that works for them, I think that's a great approach. And it's all about that, back to empowering them, so that as they grow and they leave and they're young adults, they know what makes them feel well, and potentially can avoid some of these pitfalls, which is the prevention side of things. I think it's really fascinating, you as a heart surgeon, talking about your carnivore diet, your experiences, and I've heard you say that you were low carb. I'm not sure if I heard you say you were in ketosis or not, but you were low carb for a period of time and had lots of benefits. It wasn't until you went for a carnivore approach that certain aches and pains that you were suffering started to clear up. And I think we kind of get, we do focus on weight and weight loss, and it is a massively important part of health. It's hugely, because it's a risk factor in so many other health problems later on. But there's also the link to food and other areas of health, like brain cognition, but also inflammation. So that's really powerful. But a lot of people will also be thinking of the, when carnivore is mentioned, they think about the heart health, and cholesterol, red meat, saturated fat. They're still very much part of our culture, that it's still very, very entrenched views. I think you call them part of the deadly myths around foods and nutrition.
I'm pretty clear about that. That doesn't mean that cholesterol is meaningless and doesn't matter, but there's a lot more nuance behind cholesterol than people have been led to believe, and doctors have been led to believe. So this is something that we need to start to change. But I look at the simple facts, and, there is still some ongoing debate about what exactly in the processed food, is it the refined carbohydrates, the sugar? Is it the vegetable and seed oils? And, that's a great discussion to have. But ultimately, if you just eliminate the processed food, you eliminate all of that, and all of these problems seem to go away. And, we can trace the evolution, the increase of heart disease in the U.S., and we can go country by country, and we can see how processed food gets introduced and heart disease starts to increase. So I'm very confident in saying that red meat is not causing heart disease, and I have no reservations in recommending that people eat red meat for their health. It is a health food. It's what our bodies were designed to eat. Saturated fat, the story is very complex, but again, it's not what we were led to believe. And the reality is that most of those organizations, most of those institutions that said that saturated fat were bad for our health have actually backed off of that. So here in the U.S., the limitation on saturated fat has actually been removed from the dietary guidelines. The American Heart Association has backed off their limitations on saturated fat. They've done so very quietly. They don't publicize that. But the reality is that they no longer believe that saturated fat is in our diet is what's causing heart disease. So there's no reason that people should fear eating it.
Those foods that my parents were very much told to go away from, the red meats and butter and whole dairy, and go towards low fat products, which were very, very prevalent, the 80s, 90s, 2000s. As you said, they dropped off recommendations quietly, and also the low fat recommendations have also quietly been dropped as well. So, I mean, that's really, really big news, but it's not big news. It's quite quiet about it. But I think that's really fascinating to hear from your very unique perspective, from your own personal experience, and also your professional experience as well. Your view on those types of foods that people still would be quite worried about, are still worried about, that you feel very, very confident in those natural, traditional, whole foods being healthy for us and being an important part of our diet, and satiating. I think you mentioned dropping down to 2 meals, and you offer the coaching, you offer very, very clear systems of how this can work and how people can get towards that. But one of the key things of eating more meat, more protein, more fat, more healthy fats, which you break down again as well, which ones to avoid, the seed oils, margarines, and which ones you're feeling more traditional, more healthy, more natural. But they make us feel full. So that snacking that we're reaching for, the afternoon dip when we need that caffeine fix, that sugar fix, or a carbohydrate, a packet of the crackers or some chips or something like that to lift our blood glucose, we're getting the nutrients we need, we're getting the fat, getting satiated by natural foods. So that I think that's a massively important point. Do you see the difference with the people you're coaching?
Oh, yes, definitely so. And I now have a full medical practice here in the States, where I work with people with heart disease, and they're implementing these changes, and we're seeing their heart disease stabilize, stop it from getting worse. In some cases, we're seeing reversal, lessening of their heart disease. And, I don't want to give the impression that this is some miracle and all of the blockages in the arteries melt away. That doesn't happen. But, when we look at things like a coronary artery calcium scan, which is one way to measure the progression of heart disease, we've seen some scores go down. And we certainly now commonly see the scores not go up. And that is the natural progression, that these scores continue to go up and up over time. So we're seeing great outcomes from people. They're getting off medications for things like diabetes and high blood pressure, autoimmune conditions that go away, things like inflammatory bowel disease that we see essentially being cured, or at least going into remission, depending on how you want to look at it. And, as the community continues to grow, it just never ceases to amaze me, the growing list of conditions that people have fixed with this approach. And so, now when someone comes to me and says, I have this, can I fix it? With a low carbohydrate, carnivore, keto approach, most of the time I can now point to examples and say, yes, you can. And what I do know is I haven't been seeing people get worse on this, and if meat was so harmful for our health, there have been more than enough people doing this for a long enough period of time that we should start to see the problems. And that's what I point out to my colleagues who question this. I say, where are all the carnivores ending up on my operating table? Where are all these, carnivores that are getting, diabetes that it's supposed to make worse, or whatever you want to, whatever kind of health ills have been attributed to red meat. And here are people that are only eating red meat and their health is improving. And so that's really the best evidence that I need. But thankfully, we're also getting more and more scientific, studies and data to support this. we're also uncovering all the stuff we forgot about this, because it's interesting when you go into the historical medical literature and you find physicians in the late 1800s talking about low carbohydrate diets, and early 1900s we have people talking about carnivore diets, and how they observed it in ancestral populations, and the remarkable health of the populations that were only eating meat. So again, we have the evidence that we need for this. We've forgotten so much of it is part of the problem.
And those ancestral tribes, I think Weston A. Price was one of the big reports on that showed that when processed food was introduced, those tribes that had been healthy declined really quickly in a number of different ways with their health. But just to that point that you mentioned, I think it's a massively important point. I wouldn't want to come across either as this is the magic fix. I think back to prevention and early intervention and getting on top of this and doing what you can for your health, but your parents' health as well, and your all of your wider family. It's really important. Those lab tests are really important. I think lots of different types of health conditions can be radically improved with this nutrition approach that you were setting out. I'm testament to that. Some of my listeners will know my own family story quite well. That first of all, I started with my son with alopecia and eczema, and cleared up his skin on trying a type of gut healing, low carb approach. And then with my daughter's neurological condition, did our own research, put her on a ketogenic diet, strict ketogenic diet for a period of time. So she's been on that diet for a number of years, thriving, seizures reduced majorly, but cognition was and behaviour and happiness and overall health. Just for us, the whole benefits across a number of health conditions were amazing. But I have to say, and I haven't shared this really before, while that was going on, my own dad changed his diet and he started making these health changes, and we talked about his food. He did stop smoking. He did come off sugar. He'd been on sugar, heaps of sugar, for a very, very long time. And he switched onto these particular food choices, and he was doing really well. But he did die of a heart attack, a sudden heart attack. So which is why talking to you is really, it's quite an important conversation for me. Your mission, I'm very, very much passionate about what you're talking about, getting in for your family members and their health as early as you possibly can, because you never know when it's going to be a member of your own family that something like that's going to happen. And you talk about lab, getting your blood tested, getting your lab work done, and you break that down for people. You explain how they can do that and how you can get somebody who knows what they're talking about to check in. And that was a missing part of the puzzle for us. And I think that's a really important part of your message as well, the whole health picture in it.
Yeah, so I am a big fan of, picking up these problems early and checking the proper blood work that can do so, using scans. Again, the coronary artery calcium scan, I think, is a vital tool that gets very underutilized. And it's going to vary depending where you are in the world, what access you might have to this. But, you can get a lot of information from just the very basic tests. So, one of the things I talk about in the book is the 5 basic measures of metabolic health. And I tell everyone, just start there. And if you can get these 5 measures, that's going to be a pretty good place. And again, these should be widely accessible. Anyone in the world should be able to get these tests and figure out whether or not they're metabolically healthy. 2 of the tests you can do at home. One of them is your waist circumference. So you just take the tape measure and, you want to measure just above your belly button first thing in the morning. And then your blood pressure, which you can oftentimes measure at home, or, anytime you go to the doctor, it's going to get checked. Pharmacies, grocery stores, all of these things these days usually have the little blood pressure cuff that you can check it for yourself. And then the basic blood work that you want to get is your fasting blood glucose level, your HDL cholesterol level, and your triglycerides. And one of the, I guess, good things that has come out of us being so focused on cholesterol is that everyone gets a cholesterol panel check these days, it seems. And while your doctor might focus on the LDL, the so-called bad cholesterol, or your total cholesterol level, what you can do is then look at those other two numbers, your HDL and your triglycerides, and those can give you insight into your metabolic health. And, if that's all you have, then great, you start there. Because, you mentioned the statistic earlier about 93%, of the adults here in the United States that those 5 measures of health aren't what they should be. So if you just get those 5 measures right, you're already going to be way ahead of the curve. And of course, you can go deeper. And I do with many of my clients. And you want to, ideally look at things like insulin levels. And you want to be looking at your thyroid function and your, sexual hormones, testosterone for men and estrogen and progesterone for women. These are all indicators of metabolic health. Your vitamin D level, another very important measure of metabolic health, which people don't connect, but it is closely related to metabolic health. So, you start with the basics, and then you see where you can go from there. But if all you can do is just get those 5 measures, that's going to put you ahead of the game. If people want to know the numbers, just go to my website, ifixhearts.com. Got a free quiz right there on the first page that will bring you through it, or it's in the book. And, you can figure out if you're metabolically healthy or not.
And that's really, really important, because then you can take the next level of action should you need to, and get more help. And with you had an interview with Stephen Bartlett. He's quite a big deal. His show. I was reading the comments in the Diary of a CEO, must have been the YouTube channel or the website, and they were so positive. A great deal of them were saying you are exactly how a health professional should be, how a doctor should act, and your caring, your deep caring for patients and for preventing more harm and pain and suffering came across. I thought that was absolutely really, really lovely that the public picked up on that, and I certainly feel that from you and your mission to stop people being ill enough to need these surgeries. And then there was another few comments, another type of comment that I picked up, and I've got one here, where somebody said, I too am a medical professional, and I'm rather embarrassed to say that I have been giving the wrong advice to patients over a long period of time, and I'm learning now about these different nutrition options. I just thought that's that you're having an impact, and it comes back down to my experience with my own dad, and other people's experiences. Hopefully, by you sharing this message, these tools, this information, these resources, you'll be preventing suffering. But I'm really excited that medical professionals are listening in and getting involved and learning. Is that your experience? You're hearing more and more from medical professionals interested?
Yeah, I am, and I'm very encouraged, to hear those comments, and that's really the mission that I'm on, to spread this to as many people as possible, and especially to my colleagues, to my practitioners, because I also had to admit, the mistakes that I made in the past, not knowing better, the lousy advice that I was giving people. And I do feel that I am a much better heart surgeon now, that I can incorporate this other stuff into it. And I can say, we're going to do the surgery, we're going to fix the problem that's right in front of us, but we also can address the underlying reason that you got here in the first place. And I am encouraged to be seeing more and more of my colleagues, waking up to this as well. I go to the conferences, the medical, the metabolic health conferences, the low carb conferences, and I see more and more doctors of more and more specialties. Low carb down under where you are has become a massive meeting, and again, loads of great speakers, but again, more and more doctors in the audience learning, more and more practitioners of all sort in the audience learning, and I get contacted on a daily basis, on social media and by email by doctors who want to know how they can start to incorporate this into their practice. The unfortunate thing that I see is doctors who recognize this for themselves, they do it for themselves, and then they're afraid to bring it to their patients because of our medical system and our medical environment. And I hope we're starting to overcome that. We have organizations, professional organizations now that, practitioners can join, like the Society of Metabolic Health Practitioners and the Nutrition Network, so that, you can draw upon the resources of the community. And there are, practice guidelines being developed and already released. Tim Noakes and the Nutrition Network has a textbook coming out on therapeutic carbohydrate restriction. So, these are resources that the practitioners can then draw upon and to have more confidence in putting this into practice. And I'm working on a number of other projects, besides all those things that you already mentioned that I do. There are a few others even behind the scenes that we're working on to make this more accessible for the practitioners to put into practice and to connect the people that are looking for the information and the resources to the practitioners, the coaches, the guides that they need. So we can make this movement continue to grow, because ultimately the system only changes when enough people demand that the system changes. And so that's how we're going to really succeed in this mission, is when enough people are saying, we want this instead of what you've been offering us, then the system has to respond to that.
Absolutely. That sounds exciting. I'm really excited to tune in and see what you're cooking up there. That sounds that's where I see the change happening. We've got this grassroots wave of people who are changing their own health, and then slowly that has percolated up to the medical health professionals who often become convinced because they've changed their own health, and then some brave people like yourself, Philip, are pushing this out to their patients. And then the more you can help to advance that to others, the better, so that more people can access it. I would definitely recommend your book as well, Stay Off My Operating Table. I've enjoyed reading it. It's accessible. Anybody can get something from it, no matter where you are in your journey. Like I've said, this is personal to me. I think the message you're giving out, but also the resources and the support and the tools will prevent heartbreak in some other families. So thank you so much for your work and for meeting with me and chatting with me today, Philip.
Thank you, Claire. It's been a pleasure.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.